Representing United Spinal, we have Nick LiBassi. And if you can think of any questions for Nick while he's presenting, just type them in the chat box and we will ask him those questions when he's done. But let's just get started. So here to talk about benefits of being a member of United Spinal, we do have Nick LiBassi. So take it away.
Hi, everyone. As Angie mentioned, my name is Nick LiBassi. I am Vice President of Partnership Expansion with the United Spinal Association, and I've been with the organization for about 13 or 14 years now, both as a board member and working for the organization. And Angie asked me to come on and not only give you a little bit of information about being a member and what a member includes. I think it's important to understand the history of United Spinal Association and our foundation, as being a member not only includes, tangible benefits, but it allows people to be a part of something that obviously helps people with spinal cord injury or disorders. So what I'd like to start doing is talk about our history and mission. United Spinal Association was founded in 1946 by several World War II veterans, and they came back from the war and felt they weren't getting the services that they deserved, rightfully so, and they started advocating for themselves. They actually started in New York City. A couple of them chained themselves to poles in New York City, and essentially that's how United Spinal Association started. They advocated for all types of things, but really greater civil rights and the ability to have independence for them and their fellow service members. And since our inception in 1946, our core belief really hasn't changed at all. And we really believe that despite living with a spinal cord injury, a full productive life is within grasp for anyone that has the strength to believe it and the courage to make it happen. And essentially what we do is try to give tools and offer programs and services, both at the national level as well as the chapter level. Obviously, you're all involved with the Iowa chapter, and I thank you for that. The strength of our organization, in my opinion, is our chapters. And to date, we are the largest nonprofit in the United States dedicated strictly to helping people with spinal cord injury or disease. And it's important to keep in mind a lot of the things that we advocate for benefit others that use wheelchairs as well, or have mobility impairments. And we don't exclude our membership, but we are centric for spinal cord injury and disorders. We are, as I mentioned before, we're committed to providing active lifestyle information, all different types of peer support that allows for proper advocacy that will empower individuals to achieve their highest potential in all facets of life. Currently, we have over 57,000 members, which is pretty impressive. And as I mentioned, we're dedicated to making sure that people with spinal cord injury have access to things that will help them in all different aspects of what they choose to achieve. And that could mean going to school, going back to work, caregiver information. And as I go through some of our programs and services, which I'm going to start now, just because it's important to understand exactly what we do. And even now when I speak, it's only going to scratch the surface. We go into depth in a lot of these different programs that we have. So I'll start out with our membership. I mentioned that we have 57,000 members. United Spinal Association has 49 active chapters nationwide. Each chapter is self-dependent, self-funded organizations, and they share the same goals as United Spinal Association. And though each chapter may do things differently, really what they're trying to do is build a community and offer programs and services that are relevant to the people in their area. We have chapters all over, as I mentioned, and certainly the chapter in Southern California does different things than the chapter in Boston, let's just say. And it's due to population, demographics, weather. It could be a host of different things. We trust that the chapters provide the services that they feel their members would best benefit from. And that ranges from promoting health and well-being, inclusion and independence in everything, as I mentioned before, whether it's housing, school, or the workplace. They organize local events and projects, very similar to what Angie and the board has done with this event. They advocate for rights and accessibility And they can do that both at a national level, which I'll get to in a little bit, or they can do that or they can do that locally, whether it's in a municipality, county, or the state level. And all of our chapters offer information and support to one degree or another. Some chapters specialize in offering that support and information in their geographic area. Others just have the connections and make those connections as appropriate. I did mention that our chapters have different missions and programs. And again, they are dedicated to enhancing the lives of individuals living with spinal cord injury. So very similar to the national organization. And in fact, if you were to look at our mission statement at a national organization level, as well as our chapters, they're very much similar. So that's our chapter network. We also have support group network, and we have over 195 support groups throughout the country. I'm often asked, what's the difference between a peer support group of United Spinal Association and a chapter of United Spinal Association? And there are several things legally. Chapters have to have a mechanism for funding, whether they're on our group exemption, 501c3, or they file for their own. They also need to have a functioning and active board of director. They need to file articles of incorporation, whereas the support groups are much more loosely put together. Someone could just, collaborate with the local rehab hospital and decide to run a peer support on the third Thursday of every month, or whatever it may be. But we do have 195 support groups, and they are equally as important, because many cases, that's where an individual will first be exposed to others that have similar challenges as they do, or families and friends, family members. And, the support groups, in a lot of instances, I know many of the chapters, if not all of our chapters, do some form of support group. You could argue that doing these types of calls and these events are as well a form of support for individuals. I've been injured 24 years, and when I do these types of events, I always learn, and I'm always looking out for new ideas and hearing what other people have to say. And that's really a form of support group and peer support, one-on-one and in a group setting. And the other thing I think with the peer support group is that generally, when people get involved at a peer support group level, they tend to want to be involved with the chapter, just because they find it exciting and interesting to see what others are doing and how they can be involved, and ultimately sometime down the road where they can be involved to eventually help others as well. So that's our support group. I went over our membership nationally at over 57,000 chapters, support groups. And now I just want to go through some of the programs that we do nationally and have done for many, 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 many years. So we have a ton of free publications. And I urge you to go to unitedspinal.org. I'll reference that website several times during this presentation, but it's unitedspinal.org. We have a wealth of resources on there. We have a publication section. We've written many publications. We have over 15 various publications that cover many, many topics, including disability etiquette. We wrote up a book about understanding the ADA, the Fair Housing Act, women's health for women with spinal cord injury, fire safety for people with spinal cord injury. All of these are aids that allow our members to, dig more into some of their needs and to understand things that are available to them. So again, you can locate them at unitedspinal.org. How many of you, can you raise hands? How many of you are formal members of United Spinal Association? You get New Mobility Magazine? Who gets New Mobility Magazine? Well, if you get New Mobility Magazine, you're a member. That's one of the benefits of becoming a member of United Spinal Association. And again, this is a tangible benefit. A lot of the things that I'm speaking about prior to this, and we'll speak to after this, are things that we do at a national level to help individuals, as I mentioned, with spinal cord injury. So it may not be that you're getting a magazine every month, but these other things are of value to our members. So New Mobility Magazine, if you read it, you understand what it is. It's really a cutting edge active lifestyle magazine for wheelchair users. And it's really meant to show that as wheelchair users, we're not sitting in the house and, not taking initiative and not involved in sports and schooling and business and advocacy. So it's really a mainstream societal magazine. And it really, the purpose is to show the vibrant world of disability-related arts, media, advocacy, philosophy. Our stories foster a sense of community throughout the spinal cord injury community, and also empowers others to participate. So some of the things that we've covered, if you haven't read the magazine in the past, we do a lot of stuff on education. Years ago, we used to do a lot on research in regards to a cure for paralysis. We still do, but we just don't focus on that. We do more quality of life while we're using wheelchairs. What are the things that are important to us? So obviously education and work. We do an issue every year called Love Bites, which is the February issue. We do it for Valentine's Day, which is not only love, but sexuality for individuals with spinal cord injury, which is always an interesting magazine or month that we do this. We do stuff on home ownership, recreation, travel, entertainment. I mean, you name it, we do it. We try to make sure that all these different areas are represented, understanding that out of our 57,000 members, not everyone wants to do the same thing. So we try to do it pretty diverse. We do a lot on health concerns, whether it's wound care, bowel, bladder, sexual function, skin integrity. So a lot of that we do. We also have a section in there, MS Life, where there's an article or two every month for our members that have MS as well. And so New Mobility is one of the ways that we can directly reach our members. We also have a really robust resource center, and the resource center connects our members with information and various different resources, whatever it is that they call for. We have an Ask Us feature on our website. So if you were to go to unitedspinal.org and go to Resource Center, there's an Ask Us button. And really what that is, it's a direct service delivery tool that increases our public outreach efforts. So we have individuals with spinal cord injury, family members, caregivers. We have professionals throughout our hospital network that use this tool. This goes directly to our resource center, and from there, our resource center staff decides what is relevant for any particular part of our organization. So if it's a membership question, a chapter, support group, it would come to me or my colleague Lindsay. If it's an advocacy, it would go to our office in DC. And we really take pride in our ability to connect individuals with what they're looking for. So if we don't have it, we make sure that we connect them to someone that can get that for them. And that's really the biggest thing. Many delivery tools like this, not so much for spinal cord injury because we're the ones that do this, but any type of service delivery tool like this, there's always canned answers, meaning if you type in, I'm looking for accessible housing, you would get some type of canned reply that says, someone will be in touch with you shortly. In the meantime, you can go to here or whatever. We don't do that. If one of our resource center professionals aren't available, they will get right back to you and make a physical verbal connection so we can actually understand your needs and then try to get you the resource that you or your loved one or family member are looking for. So our resource center is a big part of what we do. We get somewhere between 5,700 calls a month, I think, or unique inquiries, we call them. So it could be whether it's a phone call at our 800 number or a direct ask through Ask Us. One of the things that our resource center has organized for the past 8 or 9 years is periodic webinars, and we archive all these on our website. So again, you could go to www.unitedspinal.org and check out some of the webinars we have. They're on there from, like I said, 8 or 9 years ago. So some of them might not be relevant now. Some of them are we've done early on with Social Security income benefit. Obviously stuff like that changes as the years go by, but there are other things that really don't change. So you can do that, and you can also see a schedule on our website of upcoming webinars. And you can, like I mentioned, you could archive them. I think they go back the full 8 or 9 years, so it's pretty good. So I think as I explained and started as I explained our history, we started out as an organization that started doing advocacy, and that really still remains a key focus for us. I went through a lot of things that we offer. but none of it's really possible without our ability to advocate for ourselves and to make these things available. Our public policy team is located in Washington, D.C. I know several of you have been to some of our events and have met Alex Benowitz, who's our VP of Government Relations, as well as some of our Vets First team. And I'll touch on that as we go through this. But our office in D.C. really works closely with legislative officials to ensure that all national policy does not impede the rights and or access to services and programs for individuals with spinal cord injury or disorder. And then one of the ways that we directly have impact on our legislators is our role on Capitol Hill event. I know several of you have been to it in the past. This is affectionately known as ROCH. And this is our annual legislative advocacy event, and it addresses issues that directly impacts people living with spinal cord injury and all of issues regarding quality of life. It's a really neat event. We get to, I think last year, we didn't do it this year. We had some virtual stuff because of COVID. But last year, I think we made 234 visits in one day. That means that we were directly able to influence 234 congressional leaders, whether it was on the Senate side or the House side. I think that that's very impressive. Any group that you talk to that goes to Capitol Hill and tries to advocate for themselves, no matter what the cause, 234 visits is very impressive. And the past few years, we've actually had some successes while we were in DC. And it's exciting to, have a voice and speak for yourself as well as others that may not be able to do so. So it's something that we take great pride in. We love our advocacy. We love our members that are involved in advocacy, and it's just a great thing. Part of our advocacy as well is our Vets First organization. If you recall, when I started, I said that we started out with a couple of World War II veterans. So veterans are still near and dear to our heart. We have Vets First, and our veterans organization really takes care of vets that have spinal cord injury, although we have what's called NSO, National Service Officers, and those National Service Officers interpret benefits. It's very, very complex, the VA system, and a lot of times individuals or veterans aren't sure what their benefits entitle them to. So our National Service Officers advocate on their behalf and ultimately work with the individual to allow and to teach them how to advocate for themselves within that, complex VA system. We don't turn away anyone. So as a National Service Officer or National Service Organization for veterans, we work with people with PTSD, traumatic brain injuries, polytrauma, meaning that there were multiple injuries during combat or while they were enlisted. So again, this is something that's important to us, and it helps us because, a big portion of the disability population comes through the VA system. And in many cases, from a legislative standpoint, when VA or veterans benefits or VA initiatives are passed to help benefits in any aspect of life, a lot of time that trickles down to the public sector. So it's important for us that we are involved there as well. I did mention our National Service Officers, and this program annually, we connect about 2,000 veterans a year. We get way more that call in, but that's actually the amount that we help, somewhere around 2,000. And our National Service Officers, we used to have a lot more. I think we only have 4 now. So that's pretty impressive. It's not, some of them are quick where they call in and the National Service Officer is able to guide them or direct them quickly. In many other instances, it's multiple touch points with the individual, working with the specific VA hospital in their region. And in some cases going to what's called the VISN. So the VA hospital has different regions, and then in many cases working nationally. So I think that's something great that we do. Talking about the VA system on the civilian side, on the privatized side is hospitals. We work with all of the major spinal cord centers in the country. We have about 115 hospital members. We put together a pretty robust hospital membership program about 9 years ago. And we try to be the first line of defense for individuals when they come out of the hospital. And one of the best ways to do that is through our chapters, because our chapters have, eyes and ears on the ground, but we try to partner with hospitals to make sure that as they're releasing their patients, they give them information about us so they can get to us and the chapter by extension. We have about 115 hospitals nationwide that are partnering with us, as I mentioned. We do several things with them. We give them 10 copies or however many they request a month of New Mobility magazine to put in waiting areas. I think if you all have read New Mobility magazine, I know I was injured 24 years ago. And the first time I ever was exposed to it was in rehab. And that's our goal is try to get that into people's hands, because it does early on you get to see what other people are doing, and that, you know, life isn't doom and gloom. There is possibilities out there. And even if an individual isn't ready to look at it, we know that family members and caregivers are, and it inspires and helps them to help their loved one get through it. So it's a big part of what we do. Another part of the hospital membership program is the New Beginning Backpack, which empowers individuals with a wide range of resources to help them overcome some of the challenges. We have stuff in there on accessible vans, catheters, ostomy equipment. So again, it's just something that'll help them. I know, Angie, I'm running long. I'm going to finish up quick, and then I'll just take some questions. One of the last things I wanted to mention, it's one of the programs that really helps subsidize a lot of what we do as a nonprofit. It's called Accessibility Services, and this is a program that ensures that the built environment is accessible to all people with disabilities. For instance, we work for the last 15 years, I think. We've done all the major stadiums and arenas around the country. They bring us in proactively to work with architects and their engineers to ensure that the built environment is accessible. And not only for wheelchair users, but for hearing impairment and people with visual impairments. So it's really a great service that we offer. That program has grown exponentially in the last few years. And it's staffed by, we actually have plan examiners in there. We have attorneys, architects, we have code officials, any aspect of the building from the onset when there are, from when the plans come in until the actual CO, certificate of occupancy. Our inspectors are always on the road going to check and make sure that these things are getting done to spec and to law. So it's a key part. I think the interesting thing to know about this is that since it's grown, it just means that we have much more reach. And, you know, hopefully the goal is in 10 or 15 years from now, accessibility into all these different places isn't an issue anymore, or not as big as an issue. So the last thing I just want to mention, I went through everything. If you aren't a member, I would urge you to go to unitedspinal.org and sign up to be a member. And with that, I'm going to open it up to questions. It's a lot, right?
Mary Schmidt asks, how many hospitals are partnering here in Iowa, if you know?
I don't know offhand, but I can email, I'll take a note and I can email you that, Jen or Angie. And then you can share it with them. And I'll do that once I hang up, because I need to go into another program. All of that, and there's one question.
Doug Sample asked, let me go back up, because I do think it's a question that should be discussed. Does United Spinal have an official stance they advocate for regarding the privatization of Medicaid in Iowa? The MCO system has hurt. Both Doug and Kelly are watching from the same computer. And I responded to that, and we will talk about that a little bit. The Iowa chapter's advocacy committee kind of turned into Upgrade Medicaid, because we recognized that that is a huge issue for many of our members.
Yeah, so there's really no question for me.
Is there anything from the national?
I'm not the policy expert, so we would need to find out from Alex. I know in general, we're not in favor of privatization, and there's reasons for that, but in other instances, it could be beneficial. So I'm not sure of our official stance. Again, I do membership, so I'm not 100% certain, and I don't want to mislead anyone. If you'd like, I could find out. Again, I can email Alex, and I can get you back. Let me just write this down. And I can get that back to you, and you can share it with whomever's on the call. I'm not doing a very good job of answering questions, huh? I'm 0 for 2.
I hadn't realized my chat bar setting was directly to Jen when I typed that. I didn't mean to send it to everyone. It's just like, oops.
No worries.
Great question. Matt, has the Wells Fargo Arena been evaluated for accessibility? Angie, do you know?
This is another one I could find out. When was that built? Do you know?
2005. 2005. It's located in Des Moines.
Oh, for 3 I am.
It's all right. You're still a rock star.
Well, and I should be able to get these answers, so I'll email everyone when we're done.
I asked because I went to a major conference. There was a over the weekend conference there 2 years ago, and I needed assistance in the restroom, and it did not. It was a wheelchair. It was labeled accessible stall. Yes, it was wider than others, but my spidey senses were saying that no, that it didn't meet code. If it did, it was just by a whiskers amount, but I'm guessing not.
So I didn't know one of my colleagues was on the phone, and she just messaged me that we have not evaluated the Wells Fargo.
That's a pretty heavily used facility in Iowa. I'm guessing Angie and Shelley are there more than I am, so.
Yep, and I understand that a lot of it is, you know, most of these, we rely on them to reach out to us. And they do that for a couple of different reasons. One, because they want to be compliant, so there's not lawsuits down the road. But I think hopefully more importantly, they're doing it because they want to make sure that it's accessible so they can, you know, they're not discriminating against their potential clients with whatever business it may be.
I did think of one thing here. Kelly had written to 3 of the different charities that were on the United Spinal list of possible places to look for help with funding for help with some exercise equipment. None of them even responded to her. Any suggestions on how to be more effective in pursuits like that?
So where did you get that information from our resource center?
Where did you get it from, honey?
It was a list that was emailed to me when I first joined up. It was part of a large list of groups.
Uh-huh.
And she contacted 3 of them, and not even an answer back saying we can't help. Nothing.
Yeah, I guess I understand the part that you reached out to the list. Where did the list come from? United Spinal? Did our resource center send you that list?
I do believe so.
Yeah. How long ago was that? Do you know?
6 months.
Yeah. Is it possible for you to send me that list, or send it to Angie or Jen, and then one of them can send it to me, and I'll look into it with our resource center.
Yes.
We have all knowledge books, so there's tons and tons of information in there. So in instances like this, depending upon what you're looking for, our resource center will go in, pull that data. But there's hundreds of thousands, literally, of resources in there. So we try to keep it current, but it's not always possible. So it could be that some of those places aren't available or doing that anymore. But if you send me that list, I'll have it. I'll make sure that our resource center looks at it and updates it, and then get some type of answer back to Angie and Jen.
Great. All right. Well, thank you, Nick. We really appreciate your time today and telling us a lot more about United Spinal and how important it can be. So thank you very much. We'll get more questions to you if there's any more in the chat section that come up.
Right, and I'll try to get you these answers too. Thank you so much, guys. Have a great weekend.